Hi everyone, my name's Dr. Rachel Corman. I'm the feline specialist at Cat Specialist Services. Today I'm just going to give you a quick talk about inhalational medications that we might prescribe for your cat if they have feline asthma. Basically, we use this type of inhalational chamber, and there's a separate video that will give you some instructions on how to use the chamber to administer these medications. But this video is predominantly just to give you a little bit of information about the drugs that we would use themselves. And typically, it will be one of two medications that we would look at using. The first is a preventative medication, which is generally a steroid-based medication to help try and reduce that sort of over-functioning immune system that's causing a lot of inflammation within the cat's airway. So this is a medication that your cats will typically be receiving at least once or twice a day. In addition, we might also prescribe your cat a bronchodilator, which will help to just open up their airways and just help to ease their breathing. And this medication is one that we typically will only use for short periods of time. So we'll talk about each medication now in a little bit more detail. So firstly, this is a drug called salbutamol or Ventolin, and it's a human medication. The colour of this inhaler is generally blue, but all of your medications will come with a label detailed with the name and the dosage that your patient should be receiving. If we use this medication for long periods of time, months at a time, for example, we can sometimes actually see the reverse effect and see some sort of further damage to the airways. So typically we will only recommend this medication for short periods of time, so maybe a couple of days or a week to begin with when your cat has first presented with their respiratory problem. Or if your cat is having a particular period where they're wheezing a lot or coughing a lot. What we would normally do is you give them a shake, take the cap off the end, and then basically depress the plunger at the top, and you'll see sort of a little wave of the drug come out. So this medication, as I said, is the bronchodilator, and it helps to open up the airways. And if you've been prescribed this medication, it would be the first medication that you use in your drug regime. The second medication is a preventative, so this is generally the steroid based medication. So this one is one called Fluticasone, and the colour of this chamber tends to be in different shades of orange depending on the dosage strength, which again will be determined by your vet, and you will also have a prescription label on the medication. So this medication will typically be something that the cats will be on for life, and we might start with a higher dosage of maybe 2 puffs per day, morning and evening, and then we may gradually reduce the dosage depending on how your cat is responding to their medications. So what we would do, again, we shake and then connect into the chamber like so, cover the end and do 1 puff into the chamber, and then put that over the cat's mouth and allow them to breathe, counting the valve here for at least 5 to 10 breaths. If the dosage for your cat is 2 puffs a day, 2 puffs morning and evening, then it's important that you do 1 puff, allow the cats to breathe the medication in, and then do a 2nd puff and allow the cats to breathe that medication in. Don't do 2 puffs into the chamber like so. The cats will get more medication inhaled into their system if you do separate dosing with the puffs. After the cats have had their medication, replace the cap and then you can clean this out just using some warm soapy water and just popping it down on the cupboard to allow it to dry in between uses. The main things to watch out for if you do have asthmatic cats at home, it's a good idea to get into the habit of just counting their resting breathing rates when they're asleep, and you'll find a separate video within the website detailing how to do this. And also keep an eye out for signs of coughing or wheezing, and if at any point you feel that your cat's symptoms are deteriorating, then please don't hesitate to contact us at the clinic at Cat Specialist Services. I hope this has been a helpful video for you, and don't hesitate to contact us if you have any questions.